that this thing can cause shakedown or you take the country at ransom. Really, acceptable. I use that kind of strong language as a last resort. But you don't go ask for fuel, they don't give you the fuel. Then on top of that, you go say, we're down with tools. Again, that's not fair.
Now, let me look at the concern of the workman as well. They insist on money now. If you ask them, they will tell you, say, even that 45 litre, we talk about more weekly, nobody come in quickly, make them refer or prefer the money now. Yeah. And other argument will say, not all man will get motor, so they will use that day for use them other way.
Well, again, the language very specific. If you go look the rules, the code says specifically they're entitled to 42 liters of fuel. And I think saying that now one get them. If you say they ride Okada, you can use the fuel for Okada. If you say you get private car, you can use them for private car. If you get government car, you can use them for government car. So you get that flexibility of use. All we want and for saying that evidence for the use them for fuel procurement.
So other issue where the doctors and get apart from this fuel where you say government don't ensure say una try for put this to rest by giving them the proposal for say government go agree for give but una really want to get proof for say somebody go taking fuel and now fuel they ask for now one for getting gets for do it. The other concern the monthly pay where according to them abrupt deduction be done from the Ministry of Finance. The ministry are aware of this?
Yes. Again, as I will talk, we start with COVID-19. COVID-19, we all on fed the COVID. I say multiple parties, all hands on deck, we fed COVID-19, including the health sector. And waiting they give people an extra allowance for allow them for take the risk for able for do this work. So now being risk allowance. So the risk can done considerably. So then talk to the military, then stop the risk allowance payment to the military. Then stop the risk allowance to the police. Then stop the risk allowance to the social welfare. Then with the wind down NACOVAC now, by the end of September, NACOVAC will close down considerably. They don't go from about 4,000 members of staff to only about 20 people already left it for tidy up. So the risk don't go down considerably. So what's happening? We don't shift focus now. We focus on vaccination, we focus on surveillance, we focus on lab. So what that means the risk to the staff that they anymore, or you don't reduce considerably. So then remove the allowance from the police, then remove them from all of the other sector then, but then left them to the health sector for a little longer. So in May, then stop the allowance, the risk allowance to the medical, not to doctor no more, everybody in the medical field. So remember now, say, in the past 6 months, how many cases of COVID you don't see in a Kailan, on a Kenema, on a Kabbalah, on a Pujao? So the risk don't go down considerably. So again, we don't really pay people there for risk allowance where the risk don't go down.
But if the doctor and they refer to this allowance, so you say na government don't pull come out from them pay as the monthly take home, where they, according to them press releases, now the monthly take home the Ministry of Finance cuts, but now you they refer to that as the risk allowance. Initially, when I be explained to them for no say this is to increments on our pay, not just risk allowance because of the crisis we been did that time day.
Yes, they negotiated them very thoroughly 2 years ago. So everybody knows that. Na risk allowance get. So again, a very substantial allowance they get for sick of that. But over the 2 years, they're not used to that now. They're not used to that. So you understandable way you remove the risk allowance where the risk not there anymore, then your salary will drop. But the good thing now, the government will say, okay, we understand say the salary don't, the take home don't drop now. What you go do, instead of law begin talk about risk allowance now, what you do starting in September, we will increase our salary for come back to the level we have been there, so that we have no losses at all. So then they raise the salary. So the government now set aside about 20 billion for able to cover that going forward. So now then they say, which you don't ask for really, you don't get not to as allowance, but as actual salary increase. So now then they say, okay, well, what's happening between May and August now? Well, May and August, the risk not being there, so they get the risk allowance for. Again, if you start that now, The military self goes and say, well, we self we're entitled to this. The police self then they say, okay, so we're entitled to that. Everybody will say we're entitled to that. So that's what the doctor no
you earlier mentioned say government already approved budget for the fuel for the begin give them.
Yes.
And also they talk about the money when they ask for increments, it don't be approved by September, they start for enroll.
Yes.
But as we talk, so the medical lookman then they're on strike now. Who said the difference there, even though they say the government don't already
they really they struggle with and they struggle with that because you ask for fuel, they don't give you fuel. You ask for allowances which they don't take from you, the government don't decide for okay, let's not talk about allowance anymore because it don't make sense for give you COVID allowances when COVID don't go down. What should they do now? They make up for that by increasing your base salary. For that you don't make no loss because of the COVID situation. But it get for start on September. So now what's in there? They say, no, we want the payments from May all the way to September. And again, if you do that now, you don't say, well, the military themselves will come, everybody else will come, all of the nurses themselves will come, everybody will come, say, well, where we are now? And that ain't not go fair to them. For all we give the doctor, and then we'll not give everybody else. And the risk not there.
They talk about the doctors them and earlier we start for talk when they talk about the Mutkadem or the boss them where they deliver service, well body service. You talk about different set of workmen, you get the pharmacists, you get the nurses. Yeah. This risk allowance reduction or plus. Now only the medical and dental association they affect on across the board of health workers.
So that's not the joy for the government. The government decides say we they give a compensation, we they give an increase in salary across the board for cover that loss in COVID. So not only doctors, nurses, pharmacists, midwives. So everybody else is extremely glad about this. Now make the nurse and they go work. Now make the pharmacist and they go work. Everybody glad about this because not to allowance you to talk about now. This now an increase in salary, we will go on forever. I mean, allowance is finicky. They can say, well, you get allowance or you don't get the allowance tomorrow. Or you don't make it codified into law, into your salary, it will go on forever. So the main contention now between May and August, they say for give them allowances, risk allowances for cover that period day. But risk not been there, and other people they don't drop. We don't shut down most of NACOVAC. Why make people can give this special group them by themselves, risk allowance where everybody else they get a risk allowance. Say you're not fair on everybody else, and the government don't really do well. Look in front of me, 20 billion leons in this very, very difficult economic climate. They make it available to them.
Will they continue to look at these issues in the program? You name now Dr. Austin Debin, the Minister of Health and Sanitation. Inside the program, they talk about the concern of the well-body Okumadem where they on sit on strike now. Inside the program, we continue to look at more issues. We say after we then see government able to meet the demand, doctors them begin the sit-down strike yesterday, August 1. But for now, all this day, Hamburg, the health sector, we report out one Kama, we go work and some hospital them in Freetown. We say people will go for medical service, being called on government for make them look inside the doctor and concern for ensure say they start the service so then they give them. Well, we join Usman Kamara, we work at a different hospital.
Presently, at the Kiama Government Hospital, as you know, doctors they may put 21 days ultimatum. Also, they say if governments not look into the condition of service, they not go work. And that particular term they will give governments, they don't expand when at July 31st. Well, for sake of this make, I can't work at the Kiama Government Hospital for see how situation turn after we doctor them don't start for strike. And at the enter the gates, and I just reached the first building, and for Musa Timap, you see some comrades, all them picking them. I see something like two nurse system. They look some of the picking them where the comrades come with. Well, from that point, there, I work down the main building. And the main building where I enter, down the most patients then can sit down for wait for make doctors them look at different medical condition them. Well, for Musa team up and waiting at the scene at that, not just few people, and some of them where I ask them, even though they may say they know they talk to me for make a record them, but them explain give me say from where they can this morning, and they just tell them say let them sit down, then go come see to them. Well, from that point they are the claim this step Well, I don't reach up the last floor of the building. I deal with the hospital secretary, Mr. Bayo. We go can explain Giwi how situation don't turn this morning at the Kiama Government Hospital.
Presently, we in the hospital, especially the Kiama Hospital, we don't try for put then we CHOs them, then we'll be the backup the doctors them. We don't try to bring them on board as a standby for pushing the situation while the negotiations they go on.
Alright, so from this morning, doctor they don't come as normal the way they're supposed to be?
For this morning, with me, I'm not see the doctor yet, right? But the medical superintendent and me, serving the hospital secretary, we there, we try to put things together for the interest of the patient.
Right, so
why the negotiation they go.
Alright, so if this continues, what's the impact we think it will bring to the society in general?
We pray that make it not continue, because what it mean land is that the negotiation is going on, and probably a day or two we will resolve this. This is not the reason why we don't bring the CHOs that are on board, the community health officers. You know, where there is no doctor, they can chip in as the medical officers.
So from this morning on, I don't get any major case?
No, we don't get no major case yet.
Well, that's the hospital secretary in the Kiama Road Government Hospital, Tijan Biomid explaining inside the interview about the situation where they happen presently in the hospital. Well, from that point there, I take care from the Kiama Road Hospital for go down the Connaught for see waiting self they happen at this particular place. Well, as I'm in town, I say at the car at the Connaught Hospital, I just reached there and I pass around. And from what I see, again, people are not too, crowd because you just see few people. But at the time for look around, for talk to doctor or talk to any patient, for let go explain, give me what's not the situation for me and can this morning.
Now, my name is Alice Moriba. Now, patients account now. But for what doctor then say then they strike, we know they see them award. Say today self, they not go to this morning self, me picking they cry pain, it inside. Me picking inside now boy na incommode. So we left pan and say me fi say na fireborn, be not to fireborn na other sick. So don't left pan and say the sick don't boss. We don't boss now they we don't come Connaught, they say they need for do operation. But for what they said, the doctor they said then they strike, say today they not see to it. So the picking they on pain.
Yeah, me Nabi, I come with me about picking. You get a problem in hand, dislocation. But this morning I will come first until we see doctors they not can it. But later and then allow we to a logo register. From by then we don't go register then if I win at this barrier so I can wait. But from who come, let me say that the way to the passo.
So how much o'clock can this morning?
Well, I come around in 7 now reach here. So by then I don't know all the process now, so we wait for the call.
So what will be your message to government in relation to doctors them we don't start for strike?
Well, we talk to the government at least like try for arrange the doctors then to the demand. So that, because we get so many patients then I wouldn't be in it. Really. Because the doctors then keep away from the job, it will be a problem.
Well, that's not some of the patients them when they talk to me, who say something from where they come from this morning, up till now, doctors them not see to the eight. Well, we are reaching Connaught Hospital. I meet one of the civil society, Solomon Sundu, we himself can monitor waiting they happen presently na Connaught Hospital.
Usman, the better way we all come meet, we don't care. All the hospitals they were visits, most of the wards, you see the patients, they wondering this morning, they for candle rounds, the normal routine. But now the matrons and now they inside. Some of the patients the way I talk to, they say the doctors away cancer, they say they go class. And for we only listen, as they see people in there around, everybody don't become worried. In fact, they see the emergency cases the way they come inside right now. So not to say way for hide, on call for, we plead, we call on the health workers, the doctors. We know see yes, a nice folly you call for salary, but again, the expression between the ministry, but now they say that the Ministry of Finance get the issue. So we call on the government, make them really see reason so that then people will come to work back.
Well, from the time where they left the Connaught Hospital, the place not too normal as the way it's supposed to be, because you see patients they all sit on a door, some man they wait for they talk to them, and some of them say up till now they don't get doctors them for come see to them different medical condition them. Well, we will continue to monitor the different hospitals in different parts in the country with support from Joseph Sunga for the Society for Radio Democracy. Mina Usman Kamara, the reports.
The program Good Morning Salone, they continue for look at the issue we get for do with the strike where the doctors them they do right now nationwide sit-down strike as them they start them yesterday following 21 days notice where them be don't give to government for ensure so they look inside concerns them where them be don't raise for safeguarding conditions of service. We get at the studio the Minister of Health and Sanitation, Dr. Austin Demby, we don't explain so far waiting at the efforts and where governments on the make for ensure say they look into the doctor and concern them before we be sitting strike yesterday. And two and the major thing them with the doctors them they is concerned for inside the press release so them be issue gets for do with then weekly 45 liters fuel. That one day the minister don't address say them don't negotiate with them, but government wants accountability for sure say then people here they take the fuel instead of money where then they ask for. And secondly gets for do with monthly take home where then say deduction was made on. And according to the minister, is saying a risk allowance then be they add the way government don't stop because of the COVID rates we don't they go down and not see too much risk again for that job day. But the doctor then still lay on the strike. So for let we know now waiting at the way forward when the doctor then go decide for stop the strike or if then go get for meet with the government in terms of negotiations. We go on the line now. Also we get Dr. Isaac Olufemi Small, the Vice President for the Sierra Leone Dental and Medical Association. Good morning and welcome to the program, sir.
Good morning, Mabel. Good morning, everybody.
I guess you don't listen and follow up the address where the minister don't make in terms of looking into the conditions of service where under the doctor them they strike for currently, because it don't the address and they talk about waiting governments don't do for satisfy una so that una go back na the different health facilities them. Waiting on a position currently taking into consideration waiting the minister don't explain at the studio this morning.
Well, Mabel, I will start with the first one where you mentioned we get for do with the fuel. We appreciate the effort of government for letting them come out and agree say then they take their responsibility, because me don't be doctor in this country for 15 years, and even though the civil service could be state say for they get me 45 liters a week, and not we don't ever get some. And I believe say every other doctor find himself in the same situation. Now government don't come and act and say they will do the payments, they will give you the fuel. But the bone of contention there is the mode of implementation of this fuel subsidy. The problem we get with the mode of payment is that they want for use an existing system where already we know say is very problematic. First of all, they introduced a system where they call ring fencing. Now we all are aware say there are some allocations where they come up from Ministry of Finance where they do fence. Allocation to hospitals for cleaning, allocations to hospitals for diet. These are ring fence allocations. But we know from experience for say the people will actually then think they are their money they are supposed for the meat when are the cleaners and at the hospital they not reach them. So we concerned about that procedure they for say them will ring fence the allocation for doctors. We don't want a situation wherein we go send ourselves in a situation where government will say we don't send money to our ministry for let them build our fuel allowances. And then when we go to the ministry, then we say no, government not send it. And then we come back to the public for council and strike on that. So that is why we defend a situation where we know say this is a constant method of payment. And the minister they say that this process of monetizing fuel allowance, it happen. I will ask them for let it go now the Ministry of Finance and find out if it happen there. All right. So we know the claim say let them use that method. We are aware say it happen for certain individuals them and certain professionals them in the system. So that is why we are requesting that. And the second thing is that we work now an everyday job, not to a job we linked with regular allocations. We know say for people that would work like MDAs them, allocations them to various MDAs, they come maybe first quarter will come inside the third quarter of the year. We dey work every day. And so we want a situation wherein continuously we know say we feel allocate allowances, they come on a regular basis. We're not therefore be hampered with the system of allocation.
So doctor,
all right?
Doctor.
So that is the first thing. Let me just take the second issue around the salaries.
Quickly before you go to the issue of the salary, hello?
Yes.
Quickly before you address the issue of the salary, let me go back to the one we get to do with the fuel. You say una no want the ring fencing method where the government wants for use because from experience, una don't notice a challenge can they for the one them where they among that particular mode they get the fuel where they supposed to get. So in this case, now what una they ask for? Is it una want una young fuel them directly to una or na the money una want?
So that is what we ask the Ministry of Finance for. Say let them monetize the fuel allocation and then pay the money them into the account of the various doctors then. The argument where the minister they put forward now that they're not going to track people that we go there on study leave, we go down, or people that we go there on secondment. I believe say that in a purely systemic issue. Because the process for let you go on study leave, it requires you for let you get approval from all the different agencies, including the Accountant General. The Accountant General will be informed that you are on study leave. So there is no point there for saying they're not going to be able to track you. Because now the same ministry that they send you on the study leave or that they send you on secondment to other institutions. When you get your letter, you get a copy to the Accountant General and the Auditor General. So they are aware that you are not in the system and for that reason you're not supposed to benefit from the fuel. So that is not a case where we will stand on.
Sure, so the minister already don't state say governments don't agree and don't set aside over 9 billion loans where for go into fuel. Una they ask for fuel. Una they ask for fuel. But hello.
Yes,
una they ask for fuel, but you say una want let them monetize them, give una the money instead of the fuel. If government don't willing for give the fuel where una they ask for, why una want for say na money una want when a fuel in particular una they call for?
You understand the context, all right? The context. You are monetizing the fuel. That is, we are not asking for the money, but you are monetizing it so that we now do we procurement directly. You understand from the health worker because we get clear indications for say when the process where they want to introduce, which is the ring fencing, when they utilize them, there are serious problems. The ring fencing for the cleaning. Whether they do not hospitals them, go now hospitals them, you go see cleaners, they're always there on site, the hospitals, they're all dirty. You understand? And we, the Sierra Leoneans, the average Sierra Leonean, you don't need for explain to them. But now people that they don't say, government, they invest for say money for clean hospitals, they don't for use that for any other thing. Then why are the hospitals dirty? You understand? So the problem what we get is that we don't get trust in that system. All right? We don't get trust in that system. And the system what we think say, will be easily implemented is for let them monetize them and send them into the accounts of the various health workers then.
All right, so it clear said the doctor they're not ready for accept the system for go through and get the fuel, but now let them send the money now on accounts them. Let me look at the one we get for do.
Into the various health workers that we're supposed to get at the account. And that is being done in other institutions.
Let me look. The other concern we get for do with the abrupt deduction where una say the Ministry of Finance make on una pay. According to the minister, this not a deduction from una direct pay, but a risk allowance where them be they give una because of the COVID. But now the COVID cases them don't they drop. So cut across all other be they get risk allowance. They say they don't cut all, but when they reach to una say no, una want them.
All right, now give you a context on that. If I prior to this abrupt deduction, we don't plan as an association for let we meet the ministry for discuss about salary increments because of the economic situation of the country. We get a position paper where they speak to that. And if you go back to the non-system paper where they send to the ministry, they have request 100% increment. All right? The ministry that they bring come a proposal now say the COVID money where they want to use them now as an increment. All right, they are the ones that brought that proposal to us. And if we have accepted the proposal, we have been magnanimous to a large extent for accept because we get a proposal where for do with salary increments where even they go beyond waiting the government want for present to be. All right, but we've been magnanimous. What do we don't tell them that? Okay. Let us go back and backdate these increments to the 1st of May, when at that time they will deduct the money. And there are indications for that. There are arguments for that. All right? The money where they pay we as COVID allowance, these were monies that were paying taxes deducted from our own salaries. So what do they do? They cut the payee tax from salary and pay we back the money in the form of COVID allowance. All right? So if the government implemented that system for the past 18 months, and now we have 3 months when we ask for say, okay, let us backdate this proposal to the 1st of May, so that when we cover our cost, then I don't think there is an argument. Now the government no wants to go back to work. If the minister wants to go back to work, let us just backdate the issue. No, they'll just backdate them back to the 1st of May. Okay? So that is the bone of contention. And for the minister to say that COVID cases not there again as alone, I feel a bit worried. Because what is happening now is we are not doing what we were doing in the past. All right? In the past, we will do a lot of testing. Everybody knows that we go around with test people, even if you don't get symptoms. All right? But now we are not testing. People in the guide in our hospital with COVID symptoms, we're not even testing. So we're not able to validate whether COVID day or COVID not.
Doctor?
Yes, ma'am.
Finally before you the left we. Now waiting go make una go back na the hospitals them.
When the government backdates the payment of the increments to 1st of May, and when they decide for monetize and pay the fuel allowances directly into the account of the health workers, then we will go back to work. Without that, I don't think we get anything for negotiate. Thank you very much.
All right. Many thanks to Dr. Isaac Olufemi Small, the Vice President for the Sierra Leone Dental and Medical Association. We will talk to them for get the inside of the issue as we continue to look at the strike action we don't issue from yesterday, and they say it will continue. We will think say from waiting the minister don't explain as to negotiations, so they want to forget going to with the doctors. Then by now then we're able to reach at a point where then go back na the hospital, but we don't hear it from the doctor. Waiting is say go make them go back na the hospital. Well, the minister is still in the studio.
So if I look at the issue, let's take them one by one. Look at the fuel issue, and now you talk about the kit system for give them the fuel. But according to the submission of the doctor we just talked with, they not trust the process for sure say, or they not sure say they receive and regularly, so they want the money for going to their accounts them regularly, so that they will able to pull and then buy fuel.
So on that particular issue, the law is step part one. So the fundamental thing now, they need fuel. They need 45 liters of fuel a week. The government don't commit for provide that need for them. The system will be there in place where they give people the fuel. Nobody not say one day they not get fuel. Some people they get fuel, some people they don't get fuel, some people they get enough, some people they don't get enough. But the fuel been they come. Waiting have been the problem inside it now. The money with them they give for them have been open-ended money. Then they use that any way they feel, where they make sure say something they know they give priority to the doctor, especially in a large hospital. Where we say with the ring fence, that means say this money already come for fuel, Nobody know the touch am for anything else. Anything else.
So
but
una
for the
say when
fuel.
I fuel and they call and fuel and forget not to money.
Not to money they forget. And what's happen, then they conflate certain issues that, for example, this cleaning, say now ring fence, the cleaning contract and an external contract. And when you get external contract with government, what it means say the government they commission you for let you go find people and for can clean. Now you they pay them. We don't pay them for the work. The government they reimburse you after the fact. So now completely different system than from what you talk about. Right now the money is dedicated for fuel. We want for account for them. In fact, the letter will come from the Ministry of Finance. I'll read this particular session. It says the utilization of this benefit should not be in cash, but actual delivery of fuel to the eligible health workers. So it's very explicit from the Ministry of Finance. Say they want this money also for fuel procurement. So, if you put them directly into somebody's account, what's not the assurance you go able for account for the fuel? But I think
they happen already in other MD them.
Well, according to the Ministry of Finance, where they give the resources, where they look for, we research to other MDA them. That's not the case. Myself not in there, so I know they get the fuel as often as I supposed to get, but every now and again, they give you cheap. Then you cheat where you go now NP or you go now Total, you get the fuel where you want. Then they log them. They log on a very regular basis.
Now, one of the ultimatum now that's therefore receive this money now their account instead of the cheat. And so government position now that's not to the money una they send.
Because the law say you forget 45 liters of fuel a week. No. And they adhere to that law, they make the fuel available to them. Now then they say the system not they work, they not trust the system. But you don't try the system, you don't try it. We don't get the system
because they say in the past they know they receive
because what's happening in the conflate them with other systems. They will say like the cleaning system. I don't try to explain for you. The cleaning system is completely different. An external contractor you deal with. Yeah? This is a situation where the money when they come will include fuel. And in a lot of cases, the fuel not they go down to the people. And we understand that. But we go back inside it for correct that specific because when you get the fund, you know when they specify say this was or this $4.5 billion we deposit. Now only for fuel. You're not fungible. You can't move it to other areas.
So Mr. Minister, this back and forth now between governments and the doctors them same for like when you come as governments. The ball in at the court of the doctors. When you come ask the doctors, the ball in at the court of governments. Waiting now the way forward because people now where they get challenged for get access to then doctors, yeah. So many people they get challenges as is it currently. And the doctors they don't talk say now pass on do waiting and see them once before they go back to the hospitals. Waiting at the way forward.
That's not fair. That's not fair to the people of this country. You not go blackmail the country. You not go hold the country at ransom. Either you do this or I withdraw services. That is not fair. By the way, nearly all of the doctors, now taxpayer money, they pay for their education. All of them.
So not only they pay their fee in medical school.
Which medical school in this country, in this world, so they pay $1,000 a year for medical training. It's all heavily supplemented by the government. In a lot of cases, it's all grants by the government, by your money, by your taxpayers' money.
So in this case, governments go get for dance to the tune of the doctors for the sake of the public or waiting on one.
We therefore make sure, say, as we do this, we work with the government, we work with the doctor, and we appeal to their humanity. We appeal to their Hippocratic oath. The witness they want, not fuel. We don't get a system for getting the fuel. Let them accept that and let we monitor it over the next 2 or 3 weeks. I don't tell them, say, me go personally accountable for them. If you don't work according to how it is, let them hold me personally accountable for them. But what's happening? We don't give them the chance now. They not try the system. Then say, go work at the outset. Again, the evidence, the example that we then give, then they conflict multiple issues. The cleaning not a good example. The clean not a good example. We get a system now where they put in place with nearly all of the MDA that they utilize, we then use fuel cheap, forget them fuel. The first time I can government, then give you one NP card, then give you total card. When you're ready, you fill out and you get logbook, where at the end of the quarter, you reconcile and say, when I give me money, when I give me cheap, for that I get 45 liters, at the end of the month, look the receipt them, look the logbook for them. Auditable, accountable for them.
Now,
if I put the money in your account, how are we able for assure say? So again, the fundamental now fuel you want or now money you want. Now fuel you want and now money you want, and which they mean for the healthcare of these people in this country.
now let we look at the other one we get for do with the payments, and earlier you talk about the risk allowance where you see governments don't put certain amounts within they begin give them. The risk allowance they don't equate them to increasing their salary. We will start effective September this year, but then they call now say una for backdate them back to May 2022.
Again, I make up talk about this in a union where you get a genuine exchange and discussion with them. It will be slightly different because what's happened all along, everybody understands it. Everybody been get a base pay, and 2 years ago, because of COVID engagement and negotiate a pay increase with allowances, with deductions, all. In fact, in a lot of cases. Some people are actually even double their entry salary, their entry take-home pay. So again, everybody know that, and that happen for everybody. Everybody get the allowance. Well, I don't say the COVID don't go away, but the risk don't come down all across the world. It don't come down significantly, and everybody don't begin adjust to that. You know, and again, not so doctor and no more being affect COVID. Nurses, everybody, police, military, everybody been affected COVID. Now they don't remove the allowances from everybody. That don't mean say COVID done. The small money we'll get, we don't redirect them. Again, I think say Dr. Small therefore be a little careful because we not say COVID done. We don't say we they reduce the amount of allowances we they go towards them, but we know they relent in the effort for increased vaccination. We know they relent on the effort for make sure we get active surveillance for look for cases them. And anytime we detect cases, we do contact tracing, we try to contain the small outbreak that we get.
The first call we then call now that the fuel money for go to their account them. And government say no, we not they put another account, now fuel them once to give them the fuel. That now the stance of the government and also the everybody who command them. And now then they call say the allowance or the risk allowance when I don't add to the salary when I for backdate them back to May instead of September. We say when I go begin getting the allowance, the risk allowance in the form of increased salary. What in the ministry say and what in I understand on that?
Again, everybody knows say this not being COVID-19 related risk allowance. Everybody know that. Yeah. And waiting they happen. The risk don't go down, so they don't remove the allowances from everybody, not just the doctor, from everybody. But the government don't realize the kind of shock they cause to them, from them take-home pay. So in some cases for entry-level doctors, you don't nearly 100% increase in the wages from their foundation because not only them they get as part of the COVID allowance. They don't replace, they don't reinstate that. But for go back now and say, let's go back to May, and get all of the back pay from May. You said, give me the back allowances for COVID from May. They're waiting for do with all of the police, the military, the nurses, all of them, and they will be involved in COVID-19. Then say, for go back, they will give them all their allowances. In fact, some of them shut down from February. For go back, for give them all of the allowances.
So government still open for negotiations with the Medical and Dental Association because the reason why we want to let the public understand, not everybody get money for going to private hospital.
Of course.
Private health care. And I don't encourage people enough for paper doctor for the going to hospital.
Yes.
So in this case, government still open for negotiations with
the government still open for negotiations, but again, the two fundamental things that we they ask for, government don't address. Yeah, they ask for fuel. And again, we can go back to the law, go back to the Civil Service Code. a very explicit, they say you give people 42 liters of fuel. Now, that's in the code say. Yeah, they could not talk about monetizing this. If they come back, you get for accounts, say indeed you give people the 45 liters of fuel.
So, Mr. Minister, in this case, everybody just hold on to it. He don't say government don't put in on and say now yeah we they stop now in this and according to the law now for go. The doctor themselves don't put their own proposal say now we on this and they we self stand. in all of this, how soon we go see this be settled? Because at the end of the day, the overall body in our government, una na the kumbrawe for ensure say, una no have una for una picking and give them bobby, let them not cry. Because they already say, they know people them when they monetize them fuel. Una get any way for go search and sometimes then get evidence for looking to that and find a reasonable solution. Because at the end of the day, the people in the stream.
Again, in all fairness, in all fairness, what you do look for now accountability for their resources. So, again, if Auditor General can later on and say, look, you get a Ministry of Health, una get 9 billion leons for fuel. Where is the evidence that you use this to procure fuel? Now would you protect yourself for?
So no compromise in this?
Well, not to no compromise. I think say all waiting the doctor they ask for, they don't receive. All waiting they ask for, they don't receive.
But why they not go look it?
Well, now we get for post to them. And we not for take the country then at ransom. We not for make blackmail. They will make sure say the patient then pay the price. The doctor then get a very, very powerful role for playing in this country. Then get a really critical role for playing in this country. When you get that kind of power and authority, you get for use them judiciously. You get for make sure say at the end of the day, you patient they're not hurt.
Quick on, Mr. Minister, away from the doctors, and somebody just sent text message and they ask for your knowledge, say information from Mukmandem, na the 117 line say they not receive salary for over some 10 now. We are aware of that.
So the 117, again, we move back and forth. The 117 is very critical to what you do and at the healthcare. And waiting, I mean, the situation, I've been private contract to them. What you would try to do, I think over 100 of them, I mean, for move them and give them actual government PIN code so that we'll get permanent salary. Now, that they will be the work on. So again, we want to move them from a private contract into PIN coded staff so that they will get assurance of them paid. Now, that they will work.
But I don't communicate this with them for let them know.
Yes. In fact, what happened, the last time we been giving money, we let them know, say, now 1 year, we they give the money for whilst we look for transition. And so we'll talk with the directorate and see how we deal with that.
How soon the transition?
As soon as I left here, so I'll go try to find out how we deal with that.
The transition, how long it will take for transition then from that 117 private line to government?
Yeah, well again, what's in happen, we get 1,000 PIN codes where we allocate, We say we'll go ring fence, we will set aside some for the 117 staff. Again, what's in happen, then they fill out a form, then go through the interview, then go through the process, and then get selected. So again, down in all the jurisdiction, HRH, they deal with that. But we'll work with them to make sure say they're not left out because now critical function and they perform.
All right. Many thanks, Dr. Austin Dembi, Minister of Health and Sanitation, as we respond to concerns them where the doctor then gets. But up till now, we not seem to get a headway as to who's them the doctor then go back to the different hospital. But we just hope say the government and the doctor then go able for each at a point and then go call up the strike action because the report several air from yesterday where they don't and decide say they know the work. It don't affect so many people. We just hope say from here the ministry go able for meet at a point with the doctor, then let them go back in the different hospitals then.
I hope for that too, Mabel, and I really plead and they appeal to the doctor them. Let them go back to work, even as we try to solve them problem also, because the problem that we're in the raise now, not to distinct yes or no. We don't say yes to both of the issues. Now, small nuances that now we need for fix. And I think that will not for make life patient and suffer as a result of that.
All right, now this edition of the program, Good Morning Salone, go left now. Plenty thank you to the production team. Michael Sambola and Alex Lawrence Kuroma produced the program. DJ Lava get technical support. Joseph Sunga and Samuel Humper make on see live on Facebook. Until then, Mabel Kabadi say get yourself a wonderful day. Keep warm because it's raining out there. Goodbye.
Of course, Musa Kamade say bye-bye.